Hi, I'm Jason. I'm the founder of My Rehab Connection, and I'm also a clinician here at Great Chiropractic Spine and Joint Clinic located in St. Catharines, Ontario. Now, what I'm going to do in this video is review a few of the key tests that we would do in our office to assess the hip. And I'm not only going to show you how we would do it here in the clinic, but I will show you how you can do these tests yourself at home to get a sense of how healthy and how mobile your hips are, or alternatively, where there may be some issues that need to be addressed. Now keep in mind that the hip is a complicated area. Being a ball and socket joint, the hip is capable of moving in many different directions, and there are many separate and distinct muscles that surround the hip to create and control these motions. So to be thorough, we really need to perform several different tests to look at the hip. Now, even though we would perform all of these tests during a routine hip assessment, it can be helpful to separate these tests based on the specific area of the hip we're looking at. So in this video, I will review the key tests we would use to assess the posterior lateral hip region, which primarily involves the gluteal muscle group. This would include the gluteus maximus, the gluteus medius, as well as the gluteus minimus. Then in two follow-up videos, I'll review the tests we would use to assess the anterior hip, which will primarily involve the hip flexor muscles as well as the anterior hip capsule, as well as another video to assess the posterior hip capsule and the deep hip internal and external rotator muscles. And what I'll do is add links to those videos in the description below for this video. So with that said, let's review how to assess the posterior lateral hip. All right, so let's review the tests themselves. The first thing that we're going to look at is how to test the hip in this side lying position. Now the setup here is really important. When we do this in the clinic, one of the key things we're trying to do is make sure that the pelvis and the lower back stays square and doesn't compensate. So we're aware of this and we prevent this when we're doing it hands-on in the clinic. But if you're doing this at home, the best way to do this is with your back leaning up against the wall. This will prevent that lower back and that pelvis from compensating so we can get an accurate assessment of the hip itself. All right, so from this side lying position, we're going to take the top leg and we're going to bend your knee forward so that your thigh is approximately facing 90 degrees. And here what we want is your foot to be resting on the floor. And then what we're going to do, again, trying our best not to let us rotate and compensate through our lower back and the hip, we're simply going to pull the knee up as high as we can, and then we're going to let the knee drop down as far as we can. Now, the first thing that we're looking for when we're doing this is whether or not this creates any symptoms. And this motion should be completely pain-free. If there are symptoms with this, this is a significant issue because essentially we're just putting a mild amount of stress and stretch through these hip tissues. And if this is painful, this is going to be an indication that the tissue is going to be damaged or potentially injured. And if that's the case, rehabilitation of these tissues is going to be one of the primary things that our treatment plan needs to focus on, at least initially. Now, the other thing that we're looking for is simply assessing the basic function of this hip. So first off, as we're bringing this knee down, what we really want to see is that this knee gets all the way down to the floor, or at least very, very close to it. And if it can, this is an indication that we have adequate flexibility through the hip itself in this direction and through this gluteal muscle group on the posterior lateral hip. If it doesn't, and there's a gap between the knee and the floor, this is an indication that these tissues are going to be tight, and that's a flexibility issue that we're going to want to address. And then lastly, in addition to passive range, we want to assess active range. Passive range is assessing the flexibility of these tissues, but we also want to assess the ability of these muscles to contract properly. So again, from this position, keeping the foot down on the floor, we're going to try to lift that hip actively. Now, as high as we can up towards the ceiling. And again, we want to see not only how high that hip can lift, but we want to make sure there's no symptoms into that posterior lateral hip when we're doing so. All right, so again, all the way down and then all the way up. We want to make sure that that knee can get nice and high up towards the ceiling into this abduction and external rotation position. And if it can't, or if there's a big discrepancy in terms of how we can move passively versus actively, this is going to be an indication that we need to work on some strength and coordination and control of these posterior lateral hip muscles. All right, so the next test that we're going to perform is going to be similar to the first, but we have to understand that there's a lot of different muscles on this posterior lateral aspect of the hip. And some of these muscles run in slightly different directions. Some are a little bit more superior to inferior, where some run a little bit more obliquely. And we want to make sure that we're testing all of these muscles. So what we're going to do here is, again, similar to that first test, but we're changing the angle and the orientation of the hip so that in our second test here, that hip is going to be more in line with the body. So we're going to take that top leg and we're going to pull it back behind us. And again, we can let that foot rest on the floor. In this example, we're just going to get that lower leg out of the way a little bit, just so it's not getting in the way of our test. And as we saw with our first example, again, we want to make sure we're not getting any compensatory rotation through this pelvis and through this lower back. We want to make sure we're assessing the hip and only the hip in terms of its ability to move independently of the lumbar spine. So the first thing we're going to do is just our passive assessment. We're going to take this knee and I'm just going to let that knee drop down as far as I can towards the floor, seeing how far it goes. Again, similar to our first test, we want to get that knee, or we should see that knee able to get pretty darn close down towards the floor. And if we're dropping this down and we're only getting, say this far, or we're only getting 6 or 8 inches off the floor, that's a pretty good indication that we've got some tension through here, certainly through this gluteal group and likely through this IT band as well. In addition to down, we just want to see how far does that come up. Right? And in addition to our passive test, we want to see how the active test is. We want to see how the ability is for these muscles to contract and control and generate these motions. So again, actively, so I'll let go, knee down towards the floor, and then knee up towards the ceiling, high as we can go. Now, as we're coming up towards the ceiling, we want to see not only can that knee get up without that lower back twisting, but we want that knee to be able to get up as high, or at least very close to being able to get up as high as what I can pull that knee up passively. Now, if this knee can't get up all the way, if we have this tendency for that lower back to rotate, or if those muscles can't pull that knee as high up as it'll go passively, it's an indication that we've got more of a contractile issue in these tissues, okay? And if that's the case, we're gonna need to retrain or strengthen these muscles in order to make sure that they're able to perform these basic motions. All right, so there's one more test that we're going to look at, and one more test that we would routinely perform when we're looking at this posterior lateral hip region. And this is really going to be more of a test looking specifically at strength and endurance of these lateral hip muscles, right? Again, in the clinic, we're performing this manually, making sure that we don't get too much compensation through this lower back and pelvis. But once again, doing this at home, we can do this with your back against the wall to make sure we're testing pure motion and pure contraction of the hip. All right, so from this position, lower leg is just going to be bent slightly. We want our upper leg to be straight, and we want to get the setup such that this shoulder and hip and knee and foot, so this entire chain here is all lined up nice and straight. And from here, passively, I'm just simply going to lift this leg up as high as it'll go. And under normal circumstances, what we really want to see is this gets to be about 40 degrees, or at least 40 degrees as a minimum. Okay. Now, if it's not 40 degrees, it will often indicate that there's some tightness and some restriction on the adductor muscles here. We also want to test the strength of these muscles. Now, it's very important here that we test these muscles in this shortened position, because this is where the majority of problems are going to show up, or at least they're going to be easier to identify. So from here, I'm lifting up and I'm just holding. And then what I'm going to do is I'm just going to slowly start to let go of this leg. And what I want the patient to do is simply try to hold this position so they don't allow it to drop towards the floor. So I'm just going to slowly let go, hold that leg up. And we want to see if that leg can support on its own without my pressure. And what we'll see in often cases, I got it for a sec. What we'll see here is often it can't. And if that's the case, that's an indication that these muscles are very weak, especially in this end range or in this shortened or regressive position. And if that's the case, we definitely are going to need to include treatment and rehabilitation and correction of that problem in through the treatment plan. All right. But just being able to hold is generally not enough. These muscles there's a lot of demand on these muscles. They need to be quite strong and have a significant amount of endurance to maintain normal function. So again, as we're lifting up, I'm going to slowly let go and you're going to hold. All right. And then I also want to be able to push down fairly firmly and see if that patient can hold that resistance even for a good 5 or 10 seconds. All right. And these are things that should be relatively simple and straightforward and easy to do under normal circumstances, meaning that if these hip muscles are functioning under normal circumstances. All right. Now, again, if you don't have someone to help you at home with these holds, another simple way to do this on your own is, again, if we're leaning against the wall and we're doing some of our raises, we can simply check the endurance by saying how many of those repetitions can you do before fatigue. Okay, and we want to make sure that when we're doing this, that knee and that leg are getting up nice and high. And under normal circumstances, we would expect 10 or 12 repetitions to be fairly easy and fairly straightforward and fairly doable in order to consider this lateral hip musculature as functioning normally.